Hello. Yeah, no, you're totally right. Please come in. I'm sorry that I confused you. My name is Anastasia, and Dr. Eclipse delegated your checkup to me. Well, yeah, please. Yeah, you could take a seat right in front of me. That's comfortable for you. Well, I am a medical student, but soon I will be a doctor, and as you might have guessed, I will practice on you today, if you don't mind, of course. Please don't worry, I'm a professional, and very soon I will become a neurologist, so, well, I hope so. So, what I mean is that you're safe with me, and I will do my best to make this checkup as quick and as professional and painless for you as possible. Well, I'm just kidding, of course, it's gonna be painless, so, but please let me know if there is any kind of feeling of discomfort or pain while we are having different treatments and tests and stuff, okay? Yeah, please. Well, would you please tell me how have you been feeling lately? Okay. Yeah. Well, that's really great that you're feeling better. So you're on your way to recovery. No, I'm really glad to hear that. Um, okay. Well, talking about headaches, have you had any today? How are you feeling in general, like your head, your neck, after such kind of accidents? It is quite possible, yeah, that you might feel some kind of headache, so it's quite typical. Yeah, please don't be worried about that. I mean, it will get better. It will get better really soon, so yeah, you can trust me on that. I promise. Well, what about the rest of your body? Any kind of muscle sore? I will take some notes in the process, okay, while you're telling me about your symptoms and stuff. Thank you. Okay, so you were saying, right? Good. I see. Well, that's also quite common. It might be a bit unpleasant, but that's just the way it is. But once again, very soon you will be feeling so much better. Okay. And then, what about your sight and your hearing? Have you noticed any changes? Have you had any complaints related to that? To either of those? What about the feeling of taste, the sense of taste and smell? Okay. So, how was the lunch? What did you have for lunch today? Okay. Did you enjoy it? What's your favorite food then? Alright. Oh, I dig it. Okay. I'm not taking down about like your favorite food and stuff, but just all the previous things you have mentioned. Okay. Okay. We'll check all your senses. No, don't worry about that. Anything else you'd like to tell me? Any kinds of skin condition? Okay. And how have you been feeling in terms of your psychological comfort, emotionally? I mean, after such cases, people might often feel some kind of anxiety after such stress. It's quite normal. So, how are you? Okay. No, that's good. That's, yeah, you're doing a great job, like coping with all this stress and stuff. So No worries about it. Okay, good. Have there been any blood tests taken today? Yeah, because Dr. Eclipse mentioned that, yeah, she said I would have to do some, but don't worry about it. It's not gonna hurt, I promise. Alright, I suppose that all the rest we will see in the process, okay? Maybe I will take some extra notes while we are having this exam with you, this checkup. But yeah, I guess that all the rest should be fine. Well, I have your name here. What is your date of birth once again? Yeah, oh, you remember everything, right? So that's great, actually. All right. Please, would you look at light for me? Okay, I will just have a look at your pupils, the way they react to the light. Wonderful, okay. And now let me have a look at the other eye. Yeah, of course. Yeah, your pupils are supposed to shrink in size when they are exposed to bright light, and basically that's a very, very normal reaction, so yeah, that's fine. Okay, good. So now please let me just inspect this area around your eyes for a moment. Do you mind if I put on the gloves and just touch you slightly, like your face? Yeah, I just want to make sure that there are no lumps and like... Okay, give me a moment. That everything is alright the way it has to be, yeah? Okay. It won't take long. So, you know, a lot of patients say that they actually can get really like relaxed during this exam, during this kind of checkup, and afterwards they can even feel quite sleepy, and afterwards they can fall asleep easily, and yeah, so don't worry about it, it's all right. Okay, so 1 second. Yeah, you can close your eyes, you can keep them open, doesn't really matter to me. Right, what if I press here right above your eyes? Is it all right? Good. And what about here under your eyes? Okay, well, since I'm wearing my gloves, let me have a closer look at your mouth and nasal cavities, and at your throat, your neck and stuff. Okay, great. So thank you. Yeah, okay, the thyroid is all right. What if I press here on your neck? Okay, do you feel good? Wonderful. So now, can you feel my hands symmetrically on both sides of your face? Wonderful, thank you. Okay, and now let me have a look at your nose. All right, I'll take the mirror. Right. Can you breathe evenly with both nostrils? Let's check it, you know. I will just do a simple test. I will close one of your nostrils with my, just with my finger, like that. Yeah, and would you please breathe in and breathe out? Alright, amazing. So seems like it's alright, yeah? Great. And now with the other one. Yeah, I will just press it, against your septum, so no worries. It's fine. Could you please inhale and exhale? Okay, yeah. Okay, good. Now let's test your sense of smell right away. So since we have such an opportunity. Okay, I have opened this bottle. It has some substance inside, so as you can see, it's kind of like clear, but it has very distinctive smell. Okay, some kind of scent, whatever. Please take a smell. There is no hurry. It's a pretty simple test, so nothing unusual here. Something very, very common. Something that you definitely know. What does it smell like to you? Vanilla. Right, yeah. Let's just try another one, okay? Would you please, yeah, take a smell for me? Uh-huh. Wow. What do you think it is? Okay, are you sure? Let's try again with the same one, okay? It's not really cucumber, but okay. Pineapple. Right, yeah, yes, exactly. Yeah, let's try one more. So just in case, to be sure, to be on the safe side, so that what about this one? Yeah, they all look quite the same, you know. You have any idea of what it could be? Coffee. Right, yeah, wonderful. Okay, so you know, cucumber, pineapple. I pretend that yeah. Okay, so it's all right. No worries. Well, anyway, since we started with the olfactory nerve, let's check your sense of taste as well. Okay, so first I will have a look at your mouth cavity and your throat. Okay, I'll use the light again. Okay, please open your mouth. Thank you. Would you please stick out your tongue just a tiny little bit? No, yeah, that will do. I will use the spatula to press against your tongue a little bit, you know, just to have a closer, better look, be able to inspect your mouth cavity better. Okay, so the palate is just fine. Well, all the rest is okay. Good. When was your last time you had an appointment with a dentist? Well, I'm not a dentist, so, but I suppose that's, yeah, it would be good just to have a checkup, you know, just in case. Well, anyway, so the tone, everything else is just all right. Now, your sense of taste. I will put a few drops of this syrup onto your tongue, if that's all right with you. Of course it is all right with you, so you have no choice basically. Just kidding. So what I'm saying is that you will just have to, you know, taste it and tell me what it is or what it is similar to, you know. You understand what I mean? Okay. What do you think it might be? Oh, don't hurry. There's no rush. Just take your time. Cinnamon. Amazing. Let's try one more. I think that this will do. Any ideas? Okay. Orange. Right, yeah. Good. Thank you so much. Well, your olfactory nerve seems to be working just as it should. I will just take a few quick notes I don't want to actually make you wait. It's fine. So, all right. Now, let's go back to your eyesight, okay? So would you please follow the light for me? I will start by moving it really slowly and just follow it with your eyes. No, don't. Please don't move your head, okay? So just keep it that way. And I need you to follow the light with your eyes only, okay? So like, you know, you move your eyes wherever the light goes, but don't move your head, okay? Good. Exactly. Okay, wonderful. Good. Right. Okay. Now you're doing good. No worries. Okay. Now, do you know where my nose is? Exactly right here. So please look at my nose, and I might wiggle my fingers on either side, maybe on both. Just tell me when you see my fingers wiggle, when you see some movement on the sides. But I need you to focus on my face only, on my nose in particular. So I want to test your side vision, your peripheral vision, okay? So for that, you shouldn't look directly at my fingers, because that would be unfair and it won't show the real result, okay? Yeah, thank you. So, okay. Are you sure you're concentrated on my face, on my nose? Good. So, good job. Good. Okay, now please keep on looking at my face, if you don't mind, and let me know when my fingers appear in your field of vision. Can you see my fingers now? No, you can't. Okay. And what about now? Okay, so now they are like exactly in your vision. And what about now? Now you cannot see them. Okay, so please keep on looking at my face and just let me know when they appear somewhere so that you can see them. Good. Good job. Okay, you're right. Good. Wonderful. Okay, great. Good. Well, now I want you to have a look at these charts. Will test your vision acuity, okay? How cute your sight is. Cute. So what I'm saying is that I would ask you to have a look at this chart, okay? There is another one behind me, but we might skip to that a bit later. So for now, please have a look at this chart I'm holding here. Would you please read this second line for me. Wonderful, good. So this was not particularly challenging, was it? I think so. Now, please, would you read the line right above the red one, the red line? Good. Yeah, good. Good. Oh, you're doing great. Now let's make it a bit more challenging for you. Please read the line below the red one, like under the red one. Okay. Good. Well, and now let's try the very bottom one, the very last one, okay? Oh, go on, it's fine. Are you sure? Yes, now you're right. Good. You're doing good. Yes, that's right. Great, great. You're doing good. Well, now let's see if you are colorblind or not. Well, since you were able to find the red line on that chart, I think that shouldn't be too bad. Please. Okay, let's start with this one. Can you see anything on this sheet of paper? What can you see? So there are 3 circles. Can you see anything inside those circles? Do they seem kind of homogeneous to you, like one color? Or can you see like different colors inside those circles? What about this one? Can you see anything inside? What does it look like to you? What kind of shape is it? What kind of figure is it? Ooh, great. What about this one? What 2 colors can you see? And what can you see there? Okay, wonderful. And finally, the very first one. Okay. Good. No. Yeah. You're doing fine. No. Please have a look at this chart. So how many circles can you see here? There are 6 of them, right? Yeah. Can you see anything inside? What about this one? Okay, great. And what about this? Wow, wonderful. Well, I guess that Dr. Eclipse taught me that you will have a very detailed vision test, eye exam later, so I'm not gonna torture you with all these kinds of charts and stuff. That will do. So what you have already done, what you have already like shown, that's totally fine. That's actually more than enough. I can see that you're not colorblind, but like I said, you will have a few more tests of these kind with another doctor a bit later, I'm not sure if that's going to be Dr. Eclipse or somebody else, but they will let you know. But don't worry, all doctors at our clinic are really good. Like, I mean, our clinic, like the clinic where yeah, practicing. So, but I do like it here, so everybody is so professional and helpful and supportive, so that would be a perfect workplace. Okay, what I'm saying. Now I guess that it's time to check your reflexes. If everything is working fine. What you can see here is a percussion hammer. It has a relatively soft red tip, so you see, if I kind of like hit my body slightly with it, it's fine. I don't feel any pain or stuff like that, so I might do it really slightly just in order to see if your reflexes are working fine. But no need to worry, please don't be afraid of this thing, it's fine. Well, let's start with your wrists. Would you please put your hands like this way? Oh yeah, it's okay. Yeah, just hold there. You can sit still. Wonderful, thank you. Good. So you see, there's nothing really scary about it. Okay, now your knee-jerk reflex. Yeah, would you please bend your leg and put one over the other one? Exactly, just like that. Thank you. Okay. Good. Now would you please switch them? Wonderful. Now let me have a look at your... Okay. Oh, well, that will do. Okay, fine. So now I guess that we have to measure your blood pressure. Okay, if you don't mind. Okay. Well, would you please pull up your sleeve? Either arm, doesn't really matter. Yeah. Okay. No, take your time. Like I said, there is no hurry. It's totally fine. I just want you to feel comfortable and relaxed, so it's okay. That's alright. Now I will put this thing onto your, this cuff onto your arm a little bit higher than your elbow. Yeah, above your elbow. Please don't worry. It's gonna be fine. Please, you put your hand in there. Good, and I will put up a little bit higher. Okay. Is that all right? Okay, good. Right now, as I start squeezing this thing, it might actually get a little bit, you might feel some kind of pressure on this part of your arm where the cuff is located, but don't worry, it's not gonna last long, so it will be all right. Okay, so please just try to relax. Okay, thank you. So it's all right. It's a little bit like higher than it's supposed to be, but like I said, it's totally fine after what happened to you. So let me take it off, okay? Okay, now you can take it off and please give it to me. Thank you so much. No, it's alright. Your pulse is okay. Your blood pressure seems to be also fine. Like I said, a little bit higher, but not too much. Like, you know, nothing extreme. So it's gonna be alright. Dr. Eclipse taught me some of the like circumstances. It's yeah, the case. So you don't need to worry. It's totally fine. It will normalize. It will get better soon. Okay. Well, and I suppose that I will also listen to your heart, your lungs, and your stomach probably as well. Okay. So I will put on the stethoscope. Please give me a moment. Are you ready? Yeah. Okay. I hope that it's not too cold. If it is, I'm sorry. Okay. Good. Now, would you please press in? Okay. And now, okay. And now once again, press in and hold there. Breathe out. And once again, press in. Would you please hold there? Breathe out. Okay, well, the lungs, the heart are fine. Now your stomach. Have you had any complaints related to your digestion lately, or your stomach? Any kinds of stomach ache, any kind of nausea, whatever? Any other symptoms related to you? Okay. Yeah, I see that. Anything else you'd like to tell me? No, it's fine. No worries. We'll inspect everything, like I said, and take some blood tests, but it's nothing really alarming, so... Okay, so give me a moment. Okay, so the stomach. That's alright. Once again. It's fine. Well, it's okay. Now let me have a closer look. What if I press here? Does it hurt? And here? Doesn't. Okay, okay, good. Now the blood test, like I promised. I will spray this kind of like sanitizer onto your skin, okay? So please relax. Yeah. Just, you'll be fine. Are you afraid of blood? Like the look of blood? Does it make you feel nauseous or dizzy or anything? Should I be worried? No. That's great. Well, I will just spray it slightly, okay? Good. That's fine. be fine, I promise. Now, just a second. Yeah, I have already taken it out. Yeah, so the syringe is not there anymore. Didn't even notice it? Okay. So, it's alright, you know. Usually, when I have some blood tests, I don't look, like I'm not looking at this whole thing, so I just look in the opposite direction, because I can get really dizzy when something like that happens. So I don't know, maybe it's just my own blood or something. As a doctor, I'm not supposed to be afraid of this, like the way that the blood looks or something, but here we are. So it happens. It's all right. No worries. How are you feeling like right now? Okay, that's great. Yeah, we'll just need to see like some basic stuff at the level of some things in your blood, and yeah, if it's getting any better, but I'm sure it is. All right, so now let me take just a few measurements, okay? No, that's fine. You can sit kind of like lie there just the way you are. Yeah, if I need you to move, I'll let you know, okay? Okay, good, so okay, now give me your hand. Wonderful. Right, and now look at me. It's okay. Okay. And now on this side. Okay. Yeah, that's great. Everything is alright. Weight normally has to be. Okay. We haven't checked your hearing. Well, basically we have, because you have heard all my instructions perfectly well, so you knew what you needed to do, which I suppose means that your hearing is totally fine. But, you know, just in case, let me do a few short tests. No tuning forks or some kind of like beep tests. They will be at your hearing test itself, okay? So now I will just have a look at how you react to the sounds, okay? I will create some background noise with my gloves. I hope the sound is not annoying or something. Is it? Okay, and I will just tell you some words, maybe whispering them to you. You will just let me know what you hear, okay? Great. Well, a notebook, a laptop, Christmas, Halloween, pumpkin pie, cinnamon, um, 24, 57, Blanchard, and now spider. Good. Okay, well, seems like you could recreate, and maybe not like recreate, but just repeat all the words I said, which is a pretty, fairly good result, very impressive actually. Okay, now please close your eyes and tell me how many times you hear me snap my fingers like this, okay? Okay, thank you. So, are you ready? 3 times, okay, great. Good, what about now? Just twice. Now please tell me if all the snaps are on the same side, the same ear, or on different ones. And what about now? Different. Okay, get one more now. And now. Okay, good job. Well, I guess that your hearing is totally fine. And thank you so much for this exam, for this checkup. Like, yeah, I really appreciated that you were trying your best and that you were also listening really carefully to all my instructions. Yeah, not all the patients are as nice as you, so to be honest, yeah, sometimes it can be quite challenging to work with people, like you probably know, but so yeah, from my practice, yeah, I have already come to some conclusions, so I still enjoy it a lot. But yeah, thank you so much for being so nice and so supportive and friendly. Yeah, you did a great job, like I said, and I guess that I'll see you a bit later. Yeah, well, I hope so. I hope that Dr. Eclipse will let me have a checkup with you once again. So yeah, I guess that you'll stay here with us at least for a few more days, maybe even for a week or so. Yeah, in such cases, it's better to observe the patient and see how they are feeling and stuff. And also, these blood tests and stuff will have the results in a few days, like all results. So some of them will be available even like tonight and tomorrow, but some, yeah, will have to wait longer. So yeah, I guess that you'll stay with us for a while. Well, anyway, once again, like, thank you. Yeah, it's been great, and yeah, I really appreciate it. So this practice is really valuable, and like yeah, it's a great opportunity to practice, to see what it's like to be an actual doctor. So we've had a lot of stuff, a lot of practice back at university, but yeah, even now I still have a lot of things to learn too. So yeah, once again, thank you. Yeah, do you feel tired? Maybe I can get you something, some hot, like warm tea. Yeah, I suppose you're not allowed to have coffee, but yeah, some light tea should be fine. Maybe some kind of juice. Yeah, I guess that soda is not an option here in the clinic, but I can ask them, but nah, I think that it's not gonna work. Well, Anderson, do you feel hungry? Okay. Yeah, I think that the cafeteria is still like working, so I can totally get you something from there. No, you stay here. It's okay, you can get some good rest for a few hours at least, because I suppose that this room is gonna be, yeah, it's gonna be available for that. Okay. Well, thank you once again, and just wait here. I'll get you everything you asked for, and I'll be back in a moment. Yeah, I'll be back soon. Okay, wait for me. Okay.